Welcome to The Explainer. Today we're asking, how do doctors know if your back pain is actually a fracture?
You know that feeling? Your back hurts, and it just feels different than a normal muscle strain.
Unlike a typical strain, this kind of pain has its own unique signature, and a specialist knows what to listen for.
Clue number 1. The pain hits you suddenly, maybe from a simple bend, or even just a sneeze.
This is a big one. The pain gets way worse when you're standing, but gets better when you lie down.
And another thing, it's often a band-like pain, and your usual muscle treatments just don't touch it.
You put these clues together, and a specialist's suspicion shifts from muscle right to the bone.
But if the clues are there, why do these fractures go unrecognized so often? It's a great question.
Get this, a shocking 2/3 of these fractures are never formally diagnosed. They're just mistaken for something else.
Here's the problem. The default diagnosis is muscle strain, and honestly, an early X-ray can easily miss it.
You hear this all the time, and it makes sense. The symptoms can really fool you.
So a specialist's approach is like detective work. Their first job is to rule out any structural damage.
It's a methodical, 3-step evaluation. Let's break it down real quick. First up, your story. The conversation itself is a huge diagnostic tool. Every answer helps.
Then, the physical exam. They're looking for very specific things, like pain over a single spot on the spine.
Okay, look at this. You can really see the difference. The focus, the tools, the whole approach is different.
And that brings us to the most critical step, imaging. This is where fractures get found or missed entirely. An X-ray is good, but it has limits. An MRI? Well, it sees things an X-ray just can't.
An MRI's superpower? It sees something called bone marrow edema. Think of it like a bright flare saying, injury here.
It's like Dr. Wood says, you have to listen to the body. The clues, the exam, the MRI, they tell the story.
And this distinction is critical. Knowing if the fracture is new or old changes the entire game plan for treatment.
For patients, getting the right diagnosis isn't just a relief. It can literally give them their life back.
So here's the main takeaway. A pulled muscle diagnosis doesn't always mean the case is closed.
It might just mean that no one has looked for the right thing yet.